English doctors began a 5-day strike amid a rise in winter flu cases in the UK. They say they want a near 30% pay increase to make up for years of below-inflation raises. But the government says it has already increased doctors' pay to a lot and cannot afford to do so again. More on this from NTD's international correspondent Malcolm Hudson.
What do we want? Pay restoration. How are we going to get it?
Doctors in England began a 5-day strike on Wednesday, protesting over pay and working conditions during a surge in flu cases. The walkout is the latest in a series of strikes this year by resident or junior doctors, who make up nearly half the medical workforce and say their pay has been eroded over more than a decade.
So there are two issues. The first one is we have a jobs crisis. Doctors cannot find work and they're being turned away from jobs. And then you talk about pay. Pay is important. We must value our doctors in this country. They are seeing better offers elsewhere.
We are losing doctors abroad to better paid jobs and a better provision of health service in Australia, New Zealand and Canada year on year. And if we don't solve it, we won't have the people we've trained in this country to treat our patients. We won't have them because they'll have been poached by other health services that recognise their value.
The British Medical Association, a union which represents resident doctors, is seeking a 29% increase this year. They say it will restore pay to 2008 levels once you account for the impact of inflation. The government says it cannot afford to increase pay more than it already has. British Health Secretary Wes Streeting called the strikes irresponsible and dangerous.
We did everything we could to avert these strikes and to stop strike action from taking place. When we came into government, we recognised what resident doctors were saying about pay, and that's why they received a 28.9% pay rise from this government. And of course, we're willing to talk to them about what we do in future years.
The industrial action adds pressure to an already stretched healthcare service. National Health Service England warned last week that hospitals were facing a worst-case scenario from a surge in cases of a virulent strain of flu. They said there may be fewer doctors on duty than usual during the strikes, requiring staff to prioritise life-saving care. Patients with less urgent conditions could face longer waits. Some appointments will be rescheduled. The NHS Confederation said the impact of the strikes is expected to continue into January and beyond. Malcolm Hudson, NTD News, UK.